everyone, I am Dr. Vyshnavi, your ENT faculty here at PrepLadder, and today I'm here to discuss briefly about what is the NExT examination, what are the probable regulations of the NExT examination, what are the advantages, disadvantages, so on and so forth, and basically how to study ENT for the NExT examination. So the points for discussion for today will be what is the goal of the NExT examination and what are the advantages of NExT over NEET, how to study ENT for the NExT examination, which is your national exit examination, and how PrepLadder will help the students to ace the examination. So we will have a MCQ discussion at the end of the session to just give you a glimpse of our next Q bank that is coming up, that is NExT Ready. So keep hooked on until the end. So what is the central goal of the NExT examination? Basically, every college has its own university examination, like it is conducted in each state by the university. So here in NExT, they're trying to get a uniformity amongst all the students who are appearing for their MBBS licensure examination, so that across the country it is a single examination and students who come out of their final year are judged on a similar ground and there is no bias or discrepancy here, and everyone who practices or gets a licensure to practice in India is having that minimal skill or ability to be able to treat the patients. So it's a minimum common standards of education and training for a medical graduate that will be checked upon in this examination. Now, what is the pattern? Now, the pattern that the examination is going to be held is going to be an MCQ based pattern only. So we are going to have 6 papers. We are going to have medicine and allied subjects, surgery and allied subjects, OBG. We are going to have opthal. We are going to have otorhinolaryngology, which is nothing but your ENT, and we are going to have pediatrics. So pediatrics, ENT and opthal are going to be 60 marks each, and each exam is going to last for 1.5 hours, whereas medicine, surgery, gynec are going to be 120 marks each, and which is going to last for 3 hours session. So this is probably or tentatively the pattern of examination that is going to be held. Having said that, pre-paraclinical subjects also are going to be assessed or analyzed upon based upon your clinical questions. They are going to go back and look for your primary foundation knowledge also. So the next step 2, that was the step 1 examination, which was the theory MCQ based examination, and the next step 2 examination will be a practical and a viva voce examination. So we will have again the same 6 subjects along with orthopedics, which will be your another clinical subject for examination. And the probabilities, again, this can be held on a similar ground with objective structured clinical evaluation, or it can be held into each college university wise. There has been not much of clarity on what is going to happen in NExT 2 examination currently. So what is the expected pattern of exam paper? So basically 10% of the questions that will come for your NExT examination will be from your ANAT, physio, biochem, patho, micro, pharma, FM, etc. And the clinical implications of questions will come from this background only. 65% of the questions will be clinical vignettes question, 25% will be comprehension. Comprehension means that you have read a concept, how much you have understood that concept, and you're able to apply that concept onto a clinical situation that has been given to you in the form of an MCQ. So that is the basic understanding of a comprehensive type of question, which will be about 25%. And direct recall or memory based questions are going to be very, very less or very less in number. So only 10% of them will be recall type. So if you see this pattern, I think each and every one of you will have to have your grounds very strong, the foundation very strong, the concepts very strong, without which getting the answers right would not probably be very easy. And the intent why this examination is being held in this pattern is they want to check your clinical ability rather than recall ability. So they want to check whether you're understanding the subject right and you're able to apply that subject knowledge to a clinical situation, which is expected out of you in a real life situation. So this is the expected pattern of questions that can come to you in the examination. So the schedule breakup, we've already understood that bigger subjects, medicine, surgery, OBG will be 3 hours, and smaller subjects, ENT, opthal and Pediatrics will be 1.5 hours. But having said that, if you compare medicine, surgery versus ENT and opthal, they're very small subjects, but they are now going to be very high yielding. Like you can finish ENT and opthal in maximum of about 15 to 20 days. You can revise it again and again, and make sure that you're going to ace this examination. So ENT, opthal and pediatrics will be your scoring subjects if you really prepare well for these subjects, because the amount of time you invest in these subjects is going to be less, but the reward that you will get in the form of questions in the examination is going to be very high. So I would say that please do focus on these 3 subjects to get higher amount of MCQs and higher amount of positive answers for your examination. Now, what are the advantages of NExT over NEET PG? So basically, when we are doing a single examination at the final exit point, that is the MBBS final year, we are allowing the students to get a licensure, we are allowing the students to get a rank for their entrance exam as well, and there are not going to be 2 different examinations like the theory and practical final year and then an entrance exam for the NEET. It's not going to be that way. So a single examination which will be a common ground for everybody, whether it is the Indian graduate, foreign medical graduate, or whether it is the person who's trying to improve the scores. Everyone will have a common ground. There is not going to be any bias. And since the exam is divided into 3 days, your fate is not decided only on day 1. It's going to be decided on all the 3 days. So there is a definite advantage, but also disadvantage that since the length is very long, you might have to, you might actually get very tired and exhausted by the 3rd day. But I think when we are preparing for our final year examinations also, we are used to this sort of a preparation for giving examinations for 3 to 4 days continuous. So I think that way it is okay still, even if it is a lengthy paper. But I think that having a common ground would not allow any sort of, bias or any sort of influencing of people to pass the examination and get a licensure would not be seen henceforth. And so only those who are actually knowledgeable and actually eligible to get a licensure will get it. And actually those who are good at their subject, clinical knowledge, would be getting their, ranking very well. And further, they don't have to write any examination and they can get into their corresponding PG streams as well. So I think more or less initially everyone will have a refusal, a denial to accept a new system. But I think once we are into it, we will probably like the system, or I mean that time has to say. But I think that overall it's definitively a plus advantage for people who are good at their knowledge, because ultimately there is no influential people or anybody who's trying to influence it. That sort of system is not going to work in NExT examination. Now, how to study ENT for NExT is the question. Now, since you see 60 marks is a really big amount of questions that you can get. And we do not have actually 60 chapters also in ENT. So if you actually see every chapter, you can expect 1 question. So if you have read ENT chapters, every chapter page to page, cover to cover, you are very high likelihood going to get your examination questions absolutely right. And first and foremost for ENT, I will tell you, it is not a mnemonic based subject. It is not a recall based subject. It is a concept based subject. Without having your concepts right, it is impossible to attempt your answers correctly, especially when they give you clinical scenarios or comprehension based type of questions, because there is always a possibility of having a confusion in your mind. So if your concepts are crystal clear, your answering ability will be very quick, very easy, and most likely you're going to hit the right answer majority of the times. So I will say that concept is something that you have to focus on when it comes to ENT. Of course, there are certain fact-based question, memory-based question. You will have to work on them as well, because 10% of them belong to that. But having said that, if you are good at your concepts, you will be able to crack ENT very, very easily. Now, only understanding the concept is not the solution. Once you have understood the concept, you should have a repeated practice, because when you practice, you are asking your brain, or you're stimulating your brain to understand the pattern of question that is being put in front of you, and your brain is analyzing that question and is trying to answer that question. So comprehension comes with practice. So to understand what is the essence of a question and what you have to answer for that particular question will come only with practice, because for every clinical scenario the answers can vary. There is no single rule for all the clinical scenarios. So only if you are able to comprehend the question well, you will be able to answer. So I'd say first, get your concepts right. Number 2, practice. Number 3, improve your comprehension or understanding ability of a question to be able to reproduce and get to the right answer. So these 3 are the basic points that I will leave you for understanding on how to attempt ENT for the next examination. But we will also train you for all of this in my classes when you join PrepLadder, and when you see the Q bank and when you see the videos. We have done a lot in terms of animations, we have done a lot in terms of concepts, we've done a lot in terms of flowchart, we've done a lot in terms of tables, so that when there is a question, there is no confusion. Everything is white and black and there is no confusion at all. So that is about how to prepare for ENT. And then now I'll just give you a glimpse of PrepLadder's NExT Ready Q bank. So we are coming with Q bank that is ready for the next examination. So I'll just give you a question for practice so that you get an idea of what these questions are like and how we are preparing you for the examination. So we have a question here which says, a 28-year-old male presents to the emergency department with a history of a road traffic accident and injuries over the face. CT scan reveals fracture of the maxilla. Which of the following is the most common nerve injured in the maxillary fracture? So there are 4 options: infraorbital nerve, trochlear nerve, mandibular nerve and supraorbital nerve. And as you can see, the answer is your infraorbital nerve. So once you know this is the answer, you know most of you would be understanding this very easily, because when we are talking of fracture of the maxilla and when there is an trauma to the face, we know that the nerve that erupts from the floor of the orbit and that supplies the cheek or the maxillary bone is the infraorbital nerve. Trochlear nerve is the nerve that supplies the superior oblique muscle. Mandibular nerve is the branch of the trigeminal nerve that is sensory. It has nothing to do with only supplying the cheek or doesn't have any role in relation to the maxillary fractures. And supraorbital nerve is present superiorly, and again it has nothing to do with supply to the maxilla or the cheek. Now, when we are talking of this question bank, if you see the question bank, we have mentioned the correct option. We have explained why that option is the correct option. What could be the other questions that can come in the form of explanations, like what are the other clinical features in maxillary fractures, ecchymosis, enophthalmos, hypostasia of the cheek, how to manage a patient with maxillary fractures, emergency management, and then how you reduce and how you fix. The incorrect options also are discussed in the same frame, because obviously when you're doing one question, you want to know the right answer, but obviously you want to know why the other options are wrong as well. So to understand the wrong options also, we have given a brief explanation why the incorrect options are incorrect, and an explanation for all of them has been given in the same Q bank. So in a continuation, you get the right answer with explanation and the wrong answers explanation as well, so that if there is a question that comes from this prerogative or this perspective, you will be able to answer it. We are also coming up with each question a learning objective, like maxillary fractures are usually associated with blunt trauma to the face. The most common nerve that is injured is the infraorbital nerve when it comes to maxillary fracture, because the roof of the maxilla is formed by the floor of the orbit, and floor of the orbit is the exit of the infraorbital nerve, so that will get injured most commonly. So once we have explained you the right wrong options, we are coming up with the learning objective as well, so that you know what is the take home message for you and what you have to remember when it comes to the examination. Let's see another question over here. This says, a 15-year-old boy presented with complaints of downward displacement of the eyeball, diplopia and enophthalmos after trauma to the face with a cricket ball. He has been diagnosed with a blowout fracture of the orbit. CT of the face shows the following finding. What would be the most common orbital wall involved? Now the options are floor, medial wall, lateral wall, and the roof. Now, in the previous question, we have already learned whenever there is a trauma to the face and when there is an enophthalmos or when there is a diplopia, there is always a possibility of the fracture of the maxilla or fracture of the orbit. Now, in the orbital walls, the floor of the orbit is the most susceptible to injury because below that there is no strong structure to hold it. There is a hollow structure with the maxillary sinus. So, the first bone to give away will be the floor of the orbit. Now, supporting this, we have a scan picture. The scan image is clearly showing you with the marked structure, there is a fracture in the floor of the orbit. So you can clearly see there is a fracture here, and this fracture segment is causing the orbital contents to prolapse downwards into the maxillary sinus. And when there is prolapse of the orbital contents downwards into the maxillary sinus, what would happen? There would be enophthalmos. Because the inferior rectus is also getting trapped, there can be diplopia or double vision, and because of trauma there is redness, ecchymosis around the orbit. So all these features are indicative, and the scan is indicative of the fracture of the floor of orbit. Now, even if the image wasn't given, you should be able to answer this question because the most common wall to be involved is the floor. Second thing, enophthalmos, diplopia, ecchymosis are suggestive of a fracture somewhere where there is an impingement of the muscle causing diplopia. And the scan, if it is given, is a supporting evidence for all the clinical history that has been explained to you, indicating that this is a fracture of the floor of orbit. So we have discussed here, this is an image-based question. We have discussed the correct option. The image shows that there is a blowout fracture. Here we see a sign called as the teardrop sign where the orbital fat herniates into the maxillary sinus. The orbital floor is the shortest of all the walls, and it is the most common wall to give away whenever there is a trauma to the orbit. We have discussed the other options as well, the medial wall, the lateral wall, and roof. Whenever there is a fracture of the medial wall, the patient may be asymptomatic with an isolated medial wall fracture. There can be probability of epistaxis or subcutaneous emphysema, but other symptoms like ecchymosis, diplopia, and enophthalmos will not usually be present in a medial wall fracture. Now, lateral wall fracture will present to you with ecchymosis, periorbital swelling, and some facial deformity. But again, the classical features of enophthalmos may not be present over here because there is no herniation of orbital contents anywhere in a lateral wall. But in the floor, we have herniation of the orbital contents into the maxillary sinus causing enophthalmos. Roof of the orbit fracture is typically associated with frontal fractures, and it is commonly seen in children, and it is similar to other orbital fractures but less likely involved in a trauma to the eyeball because obviously there is a strong bone above and you will always have that associated frontal bone injuries as well. So, learning objective is what you got to take home. You need to understand blowout fracture is caused by sudden increase in the pressure by an object that is impacting the eyeball, and the diameter is greater than that of the orbital aperture, and since the floor is the weakest wall, it gives away very easily. The bones of the lateral wall and the roof usually withstand trauma because they are very strong. They are not weak as much as the medial wall and floor is compared. Medial wall is usually asymptomatic, but floor fractures are usually symptomatic, presenting to you with diplopia, ecchymosis, enophthalmos, and anesthesia of the skin over the cheek because again the infraorbital nerve can get involved. Diagnosis can be made with a simple X-ray or a CT scan. A 3D CT reconstruction can be done to understand exactly the amount of injury so that your reduction becomes better. And definitely whenever there is a treatment, we will have to reduce the fracture and you will have to do a reconstruction. So this is how we prepare you for the examination with our next ready Q bank, where we will discuss the right option, we will discuss the wrong option, we will help you understand why this is right, why this is wrong. We will help you understand the learning objective, what you got to take home, what you got to remember, what is the inference of this particular MCQ, so that when a similar question is asked, you will be able to apply the concepts that have been taught in this MCQ. Now the next question that we have is, what about the existing NEET PG and FMGE PrepLadder users? They will definitely have the content going as it is until they are relevant examinations in our country. So they will not be affected at all. So with this, I think I have given you a good briefing about what is NExT, why we should have NExT, what are the advantages and disadvantages, and the subject-wise preparation and the subjects that are going to be, going to be tested upon. So this is what we have discussed so far, and I have given you the glimpse of the next ready Q bank and a few quick explanations so that you will be able to understand what exactly we are coming forward with. I hope you enjoyed this session and it was informative to all of you. Hope to see you all again. Until then, take care and bye-bye.
Subscribe and press the bell icon so you never miss an update from PrepLadder.